Hello, and thanks for tuning in again to another Alumni Chat. We are today with Sarah Kirchner. Sarah is the Director of Strategic Improvement for Nemours. She's a multi-night. We'll ask her to tell us about that. But Sarah, first, let me just say thank you so much for spending some time with us today to help enrich our students' understanding of the industry.
Thank you, Shannon. I'm happy to be here.
So I mentioned that you're a multi-night. How many times did you graduate from UCF?
3 times. Yes.
Oh,
I'm a
wow.
three-time graduate from UCF. So collecting the degrees, but great experiences all around.
So why UCF and what was that academic career path like?
Yeah, so I am a Florida native and had the benefit of bright futures when it was time to determine where I wanted to go to undergrad. And I applied to all the major universities across the state. I applied to Florida State and got in. I applied to UF and I got deferred. And I applied to UCF and I not only got in, but also was offered entry into the Burnett Honors College as well as the Lead Scholars Program. So I came down, and it wasn't even, to be honest, it wasn't at the top of my list, but I came down, I did the tour, and I just fell in love. And so I didn't even open my final letter from UF, so I don't know whether I got in or not, but came down to UCF and had just a wonderful undergraduate experience. I majored in interdisciplinary studies, and so I have the kind of the dual focus on communication and technical writing. And then I got my minor in health sciences. So I went through the undergraduate program and approaching graduation, trying to figure out what I was going to do next. And a very nice gentleman who is now my husband was in the MHA program and had encouraged me to apply and pursue the provost fellowship opportunity that he had the opportunity to secure. And I did. I applied. I got in. I got fellowship, and so that was kind of the next step for me was to move into the MHA program.
That's great. So, when we talk to our students, we talk about engagement. I don't suppose you were engaged in anything other than just going to school, were you?
I was very involved, yes. And so I mentioned the honors program and Lead Scholars, which are two great programs at UCF. I also had a lot of other opportunities to engage throughout my undergraduate and graduate career. So in undergrad, I worked at the rec center, and so I had a couple of roles at the rec center. I taught fitness classes, kickboxing and spin and all of that. So it was a great opportunity to build friendships and connect with students and colleagues. And then I also worked as a health and peer educator in the wellness center. And so focused on, kind of the healthy habits for students, teaching classes, going into classes and having that opportunity. So I did that program. There was a few other things that I was engaged in throughout my undergraduate career, and then also remained really involved during grad school. I held a GA position at the Wellness Center, focused on again the wellness of our student body, and then I worked for Dr. Fotler as his kind of teaching assistant and support amongst other things. So.
So Dr. Fotler was a very well respected and esteemed professor in the school back then under COPA, but in the healthcare administration program. So that must have been pretty cool to get to work with somebody like that.
It was for anybody who knew him, he was just a wonderful person, full of stories, full of joy for life, joy for teaching, joy for our industry. And so getting to sit with him for 4 hours a week and just kind of hear his stories, and also I got to help kind of dictate chapters of his book and get them transcribed, or some of the various books and articles that he supported. So I had a lot of great opportunities that came out of working for Dr. Fowler.
That's a great background.
Mhm.
So after you graduated, you haven't had anything at all to do with UCF after you graduated, though, right?
We again, we hold a lot of love for UCF in our household, and so I have been able to stay engaged. I have taught some classes, and so stayed connected through adjunct teaching, stayed engaged through some of the just the various opportunities for alumni. But I do really appreciate the opportunity to stay connected with the university, and also came back for another degree. So I have definitely stayed engaged.
Yeah, well, that level of engagement is a two-way street because we are so appreciative for our alumni who come back and support us, and you've done a great job with that.
Well, thank you. I appreciate that.
So, when I look you up on LinkedIn, it says the Director of Strategic, you know, Improvement at Nemours. Well, Nemours is a pretty impressive place, and we really haven't talked to anybody so far that was in Nemours. So, how did you get into that? You must have been there for a little while now.
I have. I've been with Nemours. I just celebrated my 13th Nemours anniversary. So almost the entirety of my career, kind of post grad school graduation. And so I actually heard about Nemours for the first time in Dr. Butler's HR class. And so he had the previous director, the founding director of HR for Nemours when the hospital opened, or was planning to open, come to the class and speak to students just about the organization and the plans. So I'd never heard of it. I hadn't, at that point in time, thought about going into pediatrics, but that was my really my first introduction. And then after graduation, I did what just about any graduating student does, and I took the opportunity that was presented to me. And so I spent a year in consulting as a kind of a junior consultant, and worked for a small company that did retail healthcare. And so we did DME stores, we did uniform stores, gift shops. The company was a partner with Morrison Management. And so what that did for me was give me an opportunity to spend a lot of time in facilities all over the US and Canada. We would do, analysis. And then I always tell people my first job was we would do the store installs. And so I'd go in and steam the uniforms and hang them on the hangers and, put all of the little medicines on the shelf in the gift shop. And so it was a humbling and also very fun job for my first job out of school. But it also told me that I did not want to work in consulting forever. I wanted to be in a hospital because I just, those of us who work in healthcare, we just love it. And so I wanted to be in a hospital and a part of a system. And an opportunity at Nemours came up. I applied, I got the role, and I was in. And so, and I've been here ever since, and have had several different roles throughout my career at Nemours. I spent the first couple of years working in our Gen Peds department, kind of doing special projects and community outreach and supporting the division chief. And then I had an opportunity to do a fellowship. And so I moved out of my kind of operational role and into a fellowship role at Nemours, and it was focused on continuous improvement. So learning improvement methodology, learning a lot about the system in a different way, lots of operational exposure. And so I did that for I think it was about a year and a half that I was in that fellowship role. And then they offered me a permanent position in the department. And I've been a part of that team ever since in various capacities. And so we evolved over the past decade from the continuous improvement team to now the transformation office. Our office includes continuous improvement, project management, strategy deployment, our clinical pathways function, the patient access center, virtual health. So our umbrella is very big. And what that has meant for my career is that I've gotten to do so many things, and learn just so much. Every day is something new. And so that has been, kind of my trajectory. And I currently serve in this strategic improvement role, which really focuses on our kind of the big messy things, right? The big things that we need to take on as a system to continue to improve for our patients. That is where me and my team come in.
That's awesome. And, when you look at, you've had a bunch of different jobs in 13 years. Somebody might say, well, this girl can't hold a job. But, but that's a very successful career track because it's a step up, step up, step up. So as we get close to the end, I want to kind of combine two things. I
Mhm.
wanted to ask you one final question about a tip that you might give to a student who said, "Hey, Sarah, what would you suggest?" But I'm going to ask if you'd be willing to frame that tip from the perspective of a mom, a
Mhm.
working mom, because I know you've had some small experience with that. So,
I
what's your
have.
advice for our student moms out there that are trying to work and take care of their kids as well?
Yeah, it's a great question. And, I feel very lucky to work for a pediatric organization where family is a priority. And so that's, I can't undersell that support of having that from your employer. But I think there's two pieces of advice that I think kind of fit together for this question. I had once had somebody tell me, in your career, say yes to everything until you turn 40, and then you start saying no. And so, without giving too much away, I'm still in the yes stage. And so, I think that saying yes to the opportunities leads to the multiple job titles that you just alluded to, because it's always been a new opportunity to grow and develop. And really just being open that the path that you thought you might go down might not be where you end up, but every opportunity gives you something new. And then the motherhood piece of that is I think that sometimes it's a yes and. And so you say yes, yes, and I need to understand how this is going to impact, my personal life, my professional life, and understand that, it's not a no, but it's a yes and. So that would be my advice: is navigating career and parenthood is understand, there's always a good chance to take opportunities, but understand the conditions that might need to come with that to make you successful all around.
Well, that's terrific. And again, I just want to thank you so much for taking some time with us. Your career path has been phenomenal. Your experience is incredible. Your contributions to UCF are very much appreciated. And this is just another way that you have done that. So, Sarah, thank you so much. And best of luck as you continue your career journey.
Well, thank you so much. I appreciate the opportunity.
Go Knights.
No nights.